Story 15. I was the patient. My mom kept bringing me to the doctor because I was continuously complaining of tummy pain. I had just started school. The doctor said I was likely just trying to get out of school and stay home with my mom. I complained the whole school year. She even brought me to the ER a few times, and they essentially said the same thing. They never did any imaging, sometimes blood work. Finally, one day I started peeing blood, and she took me right to the children's hospital, and I was diagnosed with stage 4 kidney cancer. By then it had spread to both lungs, liver, lymph nodes, and around the heart. Story 16. Mom was constantly in and out of doctors' offices and ERs for many things such as extremely tired, extreme weight gain, periods lasting months, and a bad case of dehydration. Finally, an ER doctor took notice and sent her for a CT and found a grapefruit-sized tumor in her vena cava. Later diagnosed with stage 4 leiomyosarcoma. Gave her a few weeks to live, but she battled for about 5 more years. Edit. Spelling. Story 17. I did, among my other jobs, administrative physical exams for my employer for decades. This happened over 2 decades ago. Patients had a chest X-ray and some basic labs before they were seen. I got an X-ray report that said the patient's mediastinum appeared a bit wide, and I should consider a CT scan to evaluate for an aneurysm of the aorta. Whoops. I called the patient, whom I had never seen. He was not having any chest pain and felt like his usual self, but agreed to have the chest CT done. For whatever reason, radiology did not do a full chest CT as I had ordered, but did one limited to the aortic arch and below. The aorta and mediastinum were normal, but the CT report mentioned some minor stranding extending from the left hilum of the lung extending towards the left upper lobe, which was not shown on the CT because they did a limited exam. Okay. I called the patient back, whom I still had never seen, and told him what the CT scan showed. Upon questioning, he said he had some minor pain in his left scapular area, behind the shoulder, a year before, and he had seen a clinic at a different hospital which had done a series of X-rays and nothing was wrong. The upper back/shoulder pain had not really changed over the intervening year, and he had grown used to it, the vicissitudes of aging. So I reordered a chest CT and asked radiology to do it as ordered, which a few days later they did. Double oops. The full CT scan showed a pancreas tumor at the apex/top of the left lung that had extended into the chest wall and destroyed segments of several posterior ribs, which explained the pain the patient was having. This is a very bad thing. I called the patient back again. His appointment to see me was not for several weeks, and he needed to know. He took the very bad news surprisingly well, got copies of the CT scan, and went to a local cancer hospital for further evaluation and treatment. I never actually saw him. Story 18. I've had a couple patients come in and complain about usually mild vision issues like floaters or blurry spots. But after questioning them, it starts sounding worse and worse. But one lady came in and fit the stereotypical Karen template. She was rude and demanded to be seen on a Saturday that was already fully booked. I told the staff that she could wait, and I would get to her as soon as possible. It took me almost 2 hours to get to her. She complained of a spot in her vision, usually a floater, and usually harmless. But I looked in her eyes and saw bleeding in her eye, just off the optic nerve. I asked about headaches and she confirmed. I told her she had to go to the ER immediately, and if she felt off to drive then I'd call an ambulance. She looked at me like I was crazy. I eventually convinced her she had to go right now and get checked out, as she was at risk for a stroke or aneurysm. The next day the ER called and asked if I'd be coming in to see her for the rounds. I was surprised and said I don't have any hospital privileges. I'm just an optometrist. Turns out her blood pressure was sky high, and they gave her some medication to lower it. Then her pressure dropped so low that her heart stopped, and they had to shock her back into rhythm. She came back the next year for her annual eye exam and told me I saved her life. The doctors told her she could have keeled over dead at any minute, and she still had the gall to be rude AF to everyone at the office.